So as I mentioned, the last part of the bed bath is the pericare. It's the last part. So you're going to have changed your water, and you're going to have a new face cloth, and if possible a new towel, depending on the facility you're working in. So we're going to do the female first. Please don't use a lot of soap when you're doing either male or female pericare, because the soap does break down the area. And so we just dab a little bit of soap. And you know you never put soap in your water anyway. Okay, so we have the female. We've got a new face cloth. And we have the towel in a position that we can actually wash the resident. If you have somebody in a facility and you have a sheet that wraps around and you just have the perineum that you can see, that's wonderful. Okay, so we've got a little bit of water on our face cloth, a tiny bit of soap. And we're going to go from clean to dirty, from far to near, and from top to bottom. Those are your 3 principles of cleanliness. So we're going to do the far side, down the labia, always back to your water. We're going to do the close side, back to your water. And then you're going to do the urethra, which is in the middle, and back to your water. It's as simple as that. Pat dry. Okay. The last part on anybody is the rectal area. So to turn her over, or he. And again, we're going to go from clean to dirty. So it's clean to dirty, back to your water, of course, if there's feces, and clean to dirty, and back to your water if it's soiled. Okay. And then again, you're going to pat dry. Okay. So that's our female. So with a male, it's not complicated. However, you will have a male who is either circumcised or not, and there's a little bit of a difference between the two. So we have a male here who actually is circumcised. You're going to want to use a nice clean towel. You're going to go to the tip of the penis in a circular motion, up the shaft towards the body, and then the scrotal area. Okay, so circular motion around the tip of the penis, up the shaft towards the body, and do the scrotal area. Okay, again, of course, if they can do it themselves, you'll allow that. And the rectal area, the same thing, clean to dirty. If your resident is not circumcised, you're going to be trying to pull the foreskin back a little bit. But if there is any resistance, just pull it back as far as you think you can. Okay, we don't want to have any issues here. So you pull it back as much as you can, and the same goes for the principles. Okay, around the tip, to the shaft up towards the body, and then the scrotal area. Thank you.